we are discussing the Master of Science in Athletic Training program at Wayne State University. I am the Student Services Coordinator, so I focus on recruiting and admissions and letting students know more about the program. So as we get started, I just kind of want you to think about in your head, what is athletic training? How is athletic training different than other healthcare professions? How do athletic trainers work with other healthcare professions? And how do we kind of fit within the team of those individuals providing care for patients and athletes in a variety of different settings? So as I continue to talk, I'll kind of add to this, but I just want you guys to start thinking about those things as we move forward. So some photos of what athletic trainers do. We do so many different things, and I think it's important to try to hit on all of the different aspects of the profession. So we're doing things anywhere from prevention to emergency care to treatment and rehabilitation to performance enhancement. So we're working with individuals kind of along this spectrum of getting them healthy and active. So you can see a couple different photos here. We can work in the acute setting, be on the sidelines of athletic events. We can also be in rehabilitation clinics, and we do things like taking vitals, providing supplemental oxygen. We deal with a lot of musculoskeletal conditions, but we also deal with medical illness as well. So patients who have type 1 diabetes, patients who might have epilepsy. So we're dealing with individuals not only from a musculoskeletal perspective, but also from a general medical perspective as well. So you can see some of the images here. We will see things like lacerations, you will see fractures, and then you see some of the rehabilitation photos as well on here. So a lot of different things, and depending on your work setting, you might see significantly more of one aspect of that or of the other, depending on where you're working. So athletic training is recognized by the American Medical Association, the Health Resources Services Administration, and the Department of Health and Human Services as an allied healthcare profession. It encompasses prevention, examination, diagnosis, treatment, and rehabilitation of emergent, acute or chronic injuries and medical conditions. So kind of like I was saying before, we're working all along that spectrum of preventing an injury to rehabilitating an injury, and with medical conditions as well as injuries. Athletic trainers are highly qualified, multi-skilled healthcare professionals who render service or treatment under the direction of or in collaboration with a physician in accordance with their education, training, and the state's statutes, rules, and regulations. So we are licensed in each state. So you're going to follow your education, your scope of practice, and then there will also be state laws depending on the state in which you practice, if that state has licensure. Athletic trainers function as an integral part of the healthcare team in cooperation with other health professionals. So it's definitely a team approach when an individual sustains an injury and they want to get back to doing activity. There are many different professionals who might be working with that individual, and we fit within that team of people that are going to help them. If we talk specifically about the services that we provide, we focus on primary care, injury and illness prevention, wellness promotion and education. So you might see athletic trainers in more of an industrial setting where they're focusing really on promoting wellness and education for employees. So for example, I have a colleague who works with Delta Airport, and she works with the staff and the employees and keeping them healthy and working on rehabilitation programs with them. So a little bit of a unique setting that is not quite as common as maybe our secondary schools and our colleges, but an up and coming area of athletic training. We also do emergent care. This is kind of the exciting, you're on the sidelines, you see an injury happen aspect of what we do. We're typically the first people there. If you're working in a college setting or a high school setting, you're typically providing coverage for the games and practices. And so you're there on the sidelines, you're at the hockey rink, you're there when things happen. So when an emergency situation occurs, you are the first person there to respond. This is kind of the aspect of the profession that can be exciting, can also be stressful, but we work a lot with students at preparing them and doing simulations so they feel confident going into those emergency situations. An example I like to say is, I saw a basketball player, it was an away team, and I watched her go up for the ball, and when she came down, I saw a mechanism of injury. I watched her knee kind of buckle, and I watched her tear her ACL. It happened right in front of my eyes. I kind of had my suspicions based on the mechanism that I saw, and I went out onto the court, and I did some special testing and confirmed that there was a torn ACL. So with other healthcare professionals who might help provide care for her, we're a little bit different because I was there on the scene, right? I watched it immediately happen, whereas she'll see other members of the team, but further on down the road of recovery. We focus on examination and clinical diagnosis as well. So we will, in the program, you learn how to perform an evaluation for every body part. So you'll have, the course will be set up that you'll focus on the ankle, and you'll learn all of the special testing, you'll learn all of the range of motion testing, all of the functional testing, and then you'll move on to a different body part. And you kind of do that for all the parts of the body. We also do therapeutic intervention and rehabilitation of injuries and medical conditions. So there's 2 courses within the program. The first course focuses on more of the modalities, electrical stimulation, ultrasound, diathermy, things like that. And then the second course kind of focuses on the rehabilitation through therapeutic exercise. So we work on creating like a plan of care for a patient who has a post-op injury. And so you'll kind of build a rehabilitation program for them with protocols at all of the weeks along their recovery. Regulation of athletic trainers. So like I said before, athletic trainers are licensed or otherwise regulated in 49 states and the District of Columbia. Efforts continue to add licensure in California. California is the state right now that does not have licensure. Again, licensure, once you pass your certification exam, licensure is something you apply for in the state in which you work. Typically, it involves mostly just paperwork. There isn't usually another exam or anything. There's a fee, and then you might have to do additional training. So I believe in some states there's like a human trafficking training or a child abuse training, and you do an additional training course because that's a requirement for their licensure. Athletic trainers are qualified to apply for a National Provider Identifier, or an NPI number, if you've never heard of that. The NPI number allows you to be recognized as a healthcare professional. Athletic trainers also treat a range of patients and can work in a variety of settings. Regardless of their practice setting, athletic trainers practice according to their education, their scope of practice, and the State Practice Act. So again, you have to be cognizant and do the research of the state that you're practicing in. Things might slightly vary, but we're going to, again, follow our education, our scope of practice, and the state in which we are practicing. Why use athletic trainers? So talking about all of the other members of the healthcare team, why specifically are athletic trainers such an asset to have? They provide medical services to all types of patients, not just athletes participating in sports, and can work in a variety of job settings. So I think that's something that, while it is very appealing for people who are interested in athletic training, we do work with more than just athletes. I think we can very specifically work with athletes depending on your setting, but there are other opportunities in settings, like I talked about with the industrial setting, where you might be working with employees and not necessarily just athletes. So I think the profession is really unique, that it grants you the opportunity to choose the setting that really works for you, that has the patient population that you want to work with. So that's something that I really enjoy about the profession. Athletic trainers really widespread and future workforce shortages in primary care support and outpatient rehab professions, and provide unparalleled continuum of care for patients. Something else that really has drawn me to the profession of athletic training is that we have the ability to have a lot of consistency with care or continuity of care with the patients that we're working with. If you're working in a college setting or a high school setting, you are working with those individuals typically on a daily basis. So in some healthcare settings, you don't necessarily get to see your patients all the time. If you're in physician practice in a sports medicine clinic, you're going to see them just a couple times, right? If they have a torn ACL, you'll see them initially at the injury, you might see them for surgery, and then you see them for post-op appointments, but you're not having that daily ability to monitor their rehabilitation and their recovery. Athletic trainers also improve functional outcomes and specialize in patient education to prevent injury and re-injury. Something that I think I really enjoy doing as an athletic trainer is that education component. Whether we're educating about what our profession is and what we're capable of doing, or just providing education about heat illness and how to have preventative strategies to prevent things like heat illness from happening, or we're being advocates for other components of our profession, environmental safety, prevention of injuries, performance enhancement. We have all of these opportunities to really educate and work with people on how to stay healthy and safe. Preventative care provided by an athletic trainer has a positive return on investment for employers, especially if you're in that industrial or corporate setting. ATs are able to reduce injury and shorten rehabilitation time for their patients, which translates to lower absenteeism from work or school and eventually reduce healthcare costs. So it's a positive that we're working with people in those settings to remain healthy and recover quickly. So who do we work with? I've talked a lot about this healthcare team of people and who could be included on that healthcare team. We can absolutely work with athletes, but we could also just work with a general patient population as well. We work with coaches. So in the college and university setting and the high school setting, you're working with coaches on a daily basis when you're working with those individuals. You're providing communication and updates. Physicians, so you could work maybe in a physician practice, and so you're working directly with the physician. In other instances, you're working under the physician, but maybe they're coming in for physician clinics or they're helping you provide coverage at certain events. If you work in the secondary school setting, you would work with parents because the population would be minors under the age of 18. In other settings, parents might not be a big component of what you're doing. Athletic directors, so your administrative support team can be our biggest advocates to help us do what we need to do in those settings. We can also work with physical therapists, physician assistants, and really any other member of the healthcare team that an individual might work with. So if we're seeing a patient, maybe they are going to physical therapy, but they're also seeing a massage therapist. They're also checking in with their physician. Maybe they're seeing a dietitian. So we can work with a lot of different members of that healthcare team to provide the best care possible for that individual. So where do we work? I've talked a lot about the opportunity to have these different settings. So what specifically do those settings look like? Secondary schools kind of focuses on high schools, private or public. That could also kind of have some youth sport coverage with that as well. I've worked with middle school athletes in some of the districts that I've worked in. The college and university setting, the professional and Olympic setting, outpatient rehabilitation clinics, the military setting. This is also a growing setting for us. I have a former student who was a Marine, and he went back to school, and he was kind of working in the secondary school setting, and it just wasn't quite the setting for him. And he explored the military, and he took a position in Washington, and he's ecstatic. He absolutely loves what he's doing working with the military out there. Industrial and occupational health. So that's more of that kind of corporate wellness and promotion to keep people healthy. Within hospital systems, performing arts companies, this is kind of up and coming too. If you think about things like Cirque du Soleil, stuff like that, they typically have an athletic trainer working with them and traveling with them to keep them healthy. Physician clinics, sports medicine departments, and then teaching. So kind of where I have ended up throughout my career is gotten onto the teaching side of things. If we look at the NATA, so they are the National Athletic Training Association. If we look at the breakdown of the job settings as kind of the percentage of all athletic trainers, you can see that secondary schools or college and universities and secondary schools are kind of the highest. We still have a large population of students, and then the clinic and hospital. And then down at the bottom, you'll see those emerging settings. So like I talked about with performing arts and military, smaller number of us in those settings, but those are kind of what we see as what the future holds for us. Where can we be in the future? So there's a lot of opportunity to be in a lot of different settings. Any questions on anything so far? Okay, I'll keep going. So talking about what the profession is, what we do, who we work with, and now we're going to kind of switch and come and look at athletic training education, and then specifically what Wayne State has. So athletic training uses a competency-based approach in both the classroom and clinical settings. So you're learning in the classroom, and then you're taking what you're learning and you're getting a chance to practice and to complete clinical skills in the clinical setting. So you'll be at clinical rotations or clinical experiences throughout the program. We provide comprehensive patient care in 5 domains of clinical practice. So if we talk about the profession, we look at it as a breakdown of these 5 domains, and that includes prevention, clinical evaluation and diagnosis, immediate and emergency care, treatment and rehabilitation, and then organization and professional health and well-being. CATE is the Commission on Accreditation of Athletic Training Education. You have to graduate from a CATE accredited program. We just received our accreditation in the month of June, so we are very excited to have gone through the process of seeking accreditation and getting accredited. So we are good to go moving forward. Currently with athletic training education, if you are looking at other programs, you might still see some bachelor's programs, and that they are going to exist, but that's going to be kind of done after the fall of 2022. So we're kind of going through an educational reform right now, where it was a bachelor's level education, and we are moving to a master's level education. So bachelor's programs may not admit, enroll, or matriculate after the start of the fall 2022. So that professional degree in athletic training is now at the master's level. So here at Wayne State, we did not have an undergraduate program. We started from the bottom and we built this professional master's level program. The degree change is a part of a broader vision to produce providers who are prepared to meet the challenges our patients will face in the future. So it is an exciting time in the profession of athletic training with the degree change happening. To become a certified athletic trainer, there's a couple of things that need to happen. You have to graduate from an accredited professional athletic training program, and then you will pass a comprehensive test administered by the BOC or the Board of Certification. So after the program, you will sign up and sit for this exam. It is all online. There are, they make it as interactive as possible, but the exam is online. There is not like a separate practical component. And then once you pass the exam, you have your certification, and then you would do continuing education requirements to maintain your certification. Wayne State's mission statement is here. So to develop competent, collaborative, critical thinking individuals who employ evidence-based decision-making while delivering patient-centered healthcare through dynamic and diverse didactic and clinical education experiences in preparation for BOC exam eligibility and employment opportunities. We are a graduate level professional program for students interested in becoming an athletic trainer. So our program, we start in the summer. Typically, it's the very end of June is when the semester begins, and you'll have kind of a condensed 7-ish week semester, and you'll take a couple courses that kind of get us prepared for what's to come in the fall. And then in the fall, we're moving right along, taking coursework and completing your clinical experiences. Enrollment is contingent upon admission to the WSU Graduate School, and we're looking for a cumulative GPA of a 3.0 on a 4.0 scale. Course of study is 24 months. So again, you begin in that summer semester. You're going to complete a total of 4 semesters and 2 summer sessions. So that first summer is your initial summer session. You'll go the full year, and the next summer you will have courses that start in May and go through the entire summer. And then you'll do that last year, and then you will be graduating. Again, it is a competency-based approach through classroom and clinical settings. So it's complementing what you're learning and then what you're able to practice and complete at your clinical rotations. You are assigned a preceptor, and you will work with that individual and work on refining and growing those clinical skills. It is full-time enrollment, and it is sequential. So it's not a program that you can take part-time. You have to follow, you come in with a cohort, and you will be with that cohort throughout the entire 2 years of the program. The application checklist, we are using ATCAS now. So ATCAS is a centralized application system. ATCAS is very nice because you can have everything in one location. And you also have the opportunity to upload all of those required materials for Wayne State's program. You also have to complete the Wayne State University Office of Graduate Admissions application. From there, more things about the checklist that are all found on your ATCAS portal is that courses are prerequisite courses completed with a C or better, submitting transcripts, requesting 3 letters of recommendation. We look for one of those letters to be from an athletic trainer because there is a minimum of 30 hours shadowing, and that's really for you to have an understanding of the profession and to feel confident that this is the program that you want to go into. Your personal statement is also a way for you to convey your understanding of the profession and your desire to move forward and to enter the athletic training program. We require proof of emergency cardiac care, proof of immunizations, a technical standards agreement, and then there is a personal interview. So basically the timeline, because we're a summer start, we kind of have the fall semester as our time frame to really load our application and get all of the required materials together. And then I start looking at completed applications in January. And then we typically do our first round of interviews in very early March. Program prerequisites. Completion of these courses, we're looking for a C or better. These courses are really the foundational knowledge that you need for the program. So these are required because when you enter the program, we're going to already move beyond this basic knowledge and add to these content areas. I'm not going to necessarily read this list one by one, but very high emphasis on anatomy and physiology. So you really want to feel strong and confident with that course before you enter the program, because we're going to move forward right away into palpation, origin, insertion, and action of muscles. So to say that we have like a basic anatomy course as we start, we don't. We rely on you guys having that foundational knowledge coming in. If you're interested, this is how you would apply. So the ATCAS application, you can jump on ATCAS and start an application at any time, and you can kind of build your application and add your materials. And then your fee is not due until you actually submit your application. And then, like I said earlier, we also are looking for the completion of the Wayne State graduate application as well. Here is just a a snapshot of what you see on ATCAS. So if you were to select Wayne State University as a program, this is kind of our branding page. And so this pops up and just kind of walks you through, again, what that application checklist is. And then you can see the tabs, documents and prerequisites. You have the ability to add additional documents that we request under those tabs. Here are the faculty. So our program director is Dr. Gretchen Money. Our clinical education coordinator is Dr. Ashley Reed. She works very hard and is very good at assigning students to clinical rotations and maintaining communication with our preceptors. And then me, of course, student services coordinator. The curriculum, I put this up here. This is also on the website just for you to take a look. In that first summer semester, we look at pathophysiology of sports injuries and acute care. Acute care really encompasses, like I said, that emergency care component of what we do in the profession. So in that course, I teach that course, we focus on things like taking vitals, splinting fractures, providing supplemental oxygen, doing advanced airways or adjunct airways, so OPAs and NPAs, wound care. We focus on a lot of clinical skills that you'll see out in the setting. You can see kind of how things go throughout the fall and the winter semester. We really work very hard on adding to and kind of building on that knowledge that we lay initially, and you'll see that that grows each semester. Another class I like to talk about, not only because I teach it, but it's really awesome, is the clinical gross anatomy. So we are in the mortuary science lab and working with cadavers. So we look at all of the anatomy on the cadavers, and we really focus on the clinical significance. So yes, we learned where the biceps femoris muscle was, but clinically, why is that significant? Well, because hamstring injuries are very common. So understanding the origin and the insertion of that muscle is really important when treating it. Second year, you see that summer semester. We do take a class with nurse practitioners. So that's that family-centered health promotion and risk reduction course. So we're working with other healthcare professional students and taking that course with them. And then in the final winter semester, you have a clinical immersion. So this is a clinical experience, but a little bit more intense than what you've had in the past. Your other clinical experiences are about 15 to 25 hours a week, averaging around 20 hours. Whereas your clinical immersion, the goal is that you're fully immersed. So we're looking more like a 40 hours a week type of thing, not necessarily the full 16 weeks of a semester, but immersed for a condensed time period. If you have any questions, there is a frequently asked questions portion on the website that might have the answers to anything that you're thinking of. Or you can always email me. We can set up an individual call or just communicate via email. But any questions, please send them along. Thank you for your interest in the dynamic and rewarding career of athletic training. We look forward to reviewing your application very soon.